welcome to our show, Health and Wellness, Myths and Facts. I'm Gargi Rawat. Now, for a long time, women's health has sadly not received the attention due to a variety of reasons. Primary among them is the tendency of women to keep their health needs at the bottom of their priority list. The woman always prioritizes the health of her father, brother, husband and kids before taking care of herself. Today, we're talking about menopause. Menopause is a natural stage in life and part of the aging process. It marks the time when a woman's periods stop as her ovaries run out of eggs or stop producing eggs. Changes in your body in the years around menopause may raise your risk for certain health problems. It frequently happens that health issues in women are generally diagnosed when they have escalated from the basic stage, and this makes it more difficult to manage and control these conditions. Women's health must be given due focus and attention so that the overall health of the family remains well. And today we have a panel of experts who will discuss menopause and its effect on women's health. Also, if you have any questions you would like to ask the doctors, do send them to us on WhatsApp. The number will come up on your screens, and do send us your questions for the experts. Also send in your name and your location. Well, let's go across to our guests. We're joined by Dr. Swati Sachin Jadhav, a consultant endocrinologist, Sagar Hospitals, Bengaluru. Dr. Neeta Deshpande, diabetologist and obesity physician, Belgaum Diabetes Center, Karnataka. And Dr. Manasi V Harale, consulting physician, Supreme Clinic, Kurdi. Thank you so much for joining us on the show, doctors. If I can go across now to Dr. Harale. Dr. Harale, if you could answer that question about how long the menopause transition takes.
Actually, takes over a period of 5 to 7 years. It starts at the age of 45 in many women, and the transition takes place till 55 years of age. Before menopause, that is stopping of the menstruation, the woman experiences many changes due to her reproductive hormones, being estrogen and progesterones, their level going down and down when she approaches menopause. So she begins to face all the symptoms earlier also, only they are full-fledged when the bleeding cesses. So the hot flushes, the fatigability, the irritability, the pain in the calves and in the legs. So all this starts a bit before the bleeding stops, and it goes on after she achieves menopause for over 5 to 7 years.
All right. And Dr. Harale, does menopause increase the risk of heart disease, and what should a woman do to prevent the risk of a heart attack?
Yes, your first question being, does menopause increase the risk of heart disease? Yes, estrogen is a protective hormone which is present in reproductive age groups. When the woman attains menopause, her estrogen levels, they begin to drop down. This makes the heart and the blood vessels stiffen, and thus it leads to increase in the blood pressure. Increase in the blood pressure is hypertension. So hypertension increases the risk of heart attack or heart diseases. Also, drop in the estrogen levels increases the triglycerides levels in the blood. The triglyceride levels in the blood form clots, have a tendency to form blood clots, which may form in the blood vessels supplying blood to the heart, which may then lead to heart attack. It also, the drop in the estrogen levels also leads to increased blood sugar levels. That is, it increases the woman's tendency to become a diabetic patient. A diabetes is a risk factor for stroke and heart diseases. So yes, menopause does increase the risk of heart disease. Your second question is, what should a woman do to prevent the risk of heart disease? So anybody, a woman who has attained or not attained menopause but over 45 years of age should undergo certain screening lab tests. So they being ECG, cholesterol, that is lipid profile, and blood sugar levels. So when she undergoes these tests, the doctor understands if there are problem in her ECG, then she may undergo further investigations of 2D echo or angiography if need be. If her lipid profile levels, that is cholesterol levels, are deranged, or her blood sugar levels are deranged, they may be treated with medications. Also, she should have a regular physical activity of at least half an hour, at least 5 times a week. That physical activity can be anything like yoga, Zumba, aerobic classes, running, jogging, cycling, swimming, gym. So anything that she likes, but at least 30 minutes, at least 5 days per week. Also, she should maintain a healthy diet. So healthy diet is not something fancy, just avoiding junk food, limiting it to perhaps once a month. Inclusion of at least one fresh fruit daily in the diet. Inclusion of dry fruits which have a good omega fatty acid contents, like almonds or walnuts, like
Yes.
about 4 walnuts per day, or about 4 almonds per day. That will suffice.
All right. Well, we also have Dr. Jadhav with us, and I'd like to ask that question again to you, Dr. Jadhav, that when a woman approaches menopause, how long does the transition take, and also what age is there an average age, or is because sometimes you hear of women, going in or getting the first signs of menopause a lot earlier than expected.
Okay, so menopause, as we know, is menopause, that is the pause or cessation of our regular menses. So there is this typical period, what we call menopausal transition, that happens in between our routine, regular, predictable period and the stoppage of menses. And this perimenopause, what we call as menopausal transition, that typically lasts for around 3 to 4 years, which we expect to happen in our late 40s. So anything happening at that time is what we call perimenopause. And as has been described by Dr. Manasi, that here what we expect first is irregularity of our periods. And that irregularity can take the form of more frequent periods also, periods occurring earlier than predicted, and slowly it transitions into a little bit later, late period, late by 10-15 days, and much later the gaps increases to around 3 to 6 months, and finally we have our last period when we enter into the menopause. During these time, we can have a lot of hot flashes. That is a sudden sensation of heat which is centered around the chest or face, upper body, and then spreads all over the body. This can be sometimes very frightening for the patients because it can be perceived as
Right,
so sweating,
Dr.
palpitations, and feelings of anxiety can be there during these episodes of hot flashes. There can be sleep disturbances. There can be a lot of arthralgias and other things. New onset depression can be there during this period of time. So yes, it's an important period which can last for around 4 years before we get to the last period.
All right, and sounds like a very challenging period as well, given the type of things one is susceptible to. Dr. Deshpande, talking of challenges during menopause, many women gain weight as well during menopause. So why is that, and what health effect does it have?
Thanks for that question. It's a very important problem that women face when they are entering into menopause. Typically, every woman gains its expected gain of about 3 to 5 kgs during and after menopause. However, the problem is not just the weight gain. It is that most of this weight is around the middle. So there's fat around the waist, and not only just cosmetic appearance, but this fat is in and around the organs, and notably the liver. So fat in the liver, which we call fatty liver, you could call it the mother of all diseases, because this increases insulin resistance. And insulin resistance gives rise to a host of non-communicable diseases such as diabetes primarily, and also hypertension, that is high blood pressure, and cardiovascular disease, that is heart attacks. And the reason for that is the body produces insulin but not able to act properly, and that is because of the fat in the liver that interferes with the work of insulin. And that is why weight gain, fat around the middle, fat in the organs, insulin resistance is the one that causes all these problems and leads to diabetes, blood pressure, and heart disease.
All right, Dr. Harale, do women risk an increase in sleep apnea after menopause, and can sleep apnea affect high blood pressure?
Okay, let us first understand what is sleep apnea. So, sleep apnea is something which blocks your airway when you are sleeping. This leads to stopping of breathing, and this leads to less flow of oxygen in the blood. This awakens the brain, and it awakens the brain multiple times during the night, which results in disturbed sleep. The risk factor for this sleep apnea are obesity, smoking, having a thick neck, there is too much of tissue at the back of the throat, their lower jaw is back. So all these are risk factors. How does the patient of sleep apnea present? It is like excessive daytime sleepiness. The patient dozes off when having a conversation, after lunch, while driving a car. So at multiple times during the day when there is little activity, little inactivity present, the patient dozes off because she has had disturbed sleep throughout the night. Also, they may present as excessive snoring. The spouse complains of too much of snoring, unable to sleep because of the snoring of the concerned person. How we doctors investigate this is through a sleep study. So sleep study where multiple probes are applied all over, and we assess the brain activity, the heart activity, the breathing activity, the oxygen levels, and then we find out how many times in an hour there is stopping of breathing, and according to that we grade the sleep apnea. So according to the grades that it has, we can either treat it by only change of position, that will also help. There are oral devices which pull the lower jaw forward so that there is no obstruction to breathing. Then there is this machine which are called as positive airway pressure, so which help the upper airway not to get obstructed while the patient sleeps. And then there is always also surgical methods, so extra tissue at the back of the neck that I mentioned about, that can be removed. So what happens to women? Why there is an increase in sleep apnea? Of course, there is increase in sleep apnea after menopause. So that can be related to the low progesterone levels that the women have after menopause. Progesterone is known to stimulate breathing. So low progesterone levels can be a causative agent for the sleep apnea. There was one study conducted, in which there were 48% of postmenopausal women who had sleep apnea against only 22% of younger women who had it. So, of course, there is an association between menopause and sleep apnea. So your second question being, can sleep apnea actually increase the blood pressure? Now let us understand this, that during the night while we sleep, the blood pressure is supposed to fall. Normally, blood pressure falls. So imagine a plight of a person who is having multiple awakenings during the night time due to his sleep apnea condition, and that is why the BP does not fall down during night time, which actually it should. And so average BP reading of the 24 hours actually rises. This gives rise to increased blood pressure. So yes, sleep apnea is positively associated with increase in blood pressure, and we need to treat not only the blood pressure but also the cause, which is the sleep apnea.
All right. So clearly a lot of, things that women have to keep in mind when they enter menopause, and a lot of awareness also needs to be done on these issues. Doctors, will just slip into a short break and be back with more questions for you. Welcome back. You're watching Health and Wellness, Myths and Facts. I'm Gargi Rawat, and today we're talking about menopause and women's health. Let's go across to our doctors. And Dr. Jadhav, does menopause cause bone loss? How effective is hormone replacement therapy in preventing complications of menopause?
So yes, definitely. One of the most prominent health effects of menopause that we talk about is the bone loss. So by bone loss, we mean that our bone mineral density, in other words, the strength, it goes on decreasing because of the hormonal changes, the estrogen deficiency that happens during menopause. And in fact, this loss starts way before, at least a year or two before our last period when it happens. So what does that mean? That if our density goes low, or if our bone becomes less strong, we stand more chance to fractures in case the fall happens. And that is very important for us. So, of course, the hormone replacement therapy is a very effective way to prevent this bone loss. But nevertheless, this is not needed. I mean, what I need to say is just for the sake of bone prevention, we don't prescribe hormone replacement therapy. There are other effective ways which are available for bone protection. The most important of which is having a good lifestyle. By that, what I mean is having a good weight-bearing exercise, minimum 30 minutes a day, say minimum 5 days a week. That is very important. Then having adequate calcium intake, either in diet or in the form of supplements. And vitamin D supplementation is important for maintaining a good bone health. We should check our bone mineral density as per the advice of our doctors, know our bone density, and accordingly, if needed, we do start on some medications like bisphosphonates, which are in the form of tablets or injections for bone protection. So, hormone replacement therapy, while it is very effective for other symptoms of menopause like severe hot flushes, loss of libido, and other factors, like it is indicated for that, just for the sake of bone protection, we don't give hormone replacement therapy.
All right, Dr. Deshpande, as estrogen and progesterone levels go up and down during the transition to menopause, blood sugar levels can also rise and fall. How does one manage menopause when you have type 2 diabetes?
Well, there are several reasons actually for the blood glucose levels to keep on fluctuating. One, as you said very rightly, is the fluctuating levels of the hormones estrogen and progesterone. The second reason why blood glucose levels fluctuate is because of the weight gain that occurs at and during menopause, because the fat cells are very active and they could be toxic and they add to the insulin resistance, and because of this the levels fluctuate. Additionally, many studies have shown that at and during menopause, women's activity levels drop drastically. And because of that, again, the blood glucose levels can go up. The solution to this and the management thereof is that one needs to constantly monitor the blood glucose levels. You can do it with the help of a glucometer device at home and frequently monitor and get to your healthcare professional and get your medication changed. That is number one. Or the other more sophisticated way of doing it nowadays is to apply what is called as CGM, that is continuous glucose monitor, which is a small little device that is attached to your upper arm and which measures your blood sugars throughout the day and night for 14 days and gives you more than 1000 readings. So you can actually make out where fluctuations are happening, what time of the day or night. And with this, your healthcare professional will be better equipped to understand these fluctuations and change your medication as required. You might need medication that actually makes you lose weight. So there are type diabetes medications which are either weight neutral or make you lose weight. There are many tablets which can actually protect your heart and kidneys, and so on. You might need to change your insulin. Nowadays, we have so many different designer insulin. You have diabetes medications which are both oral and injectable, which help you lose not only weight but reduce your liver fat. And this is how the fluctuations in blood glucose can be managed. The weight also can be managed. The blood pressure can be managed. So keep checking frequently and getting back to your doctor and change your medication, because at menopause, this is what needs to be done.
All right, and Dr. Harale, finally, would it would be good to know some good tips to manage women's health, to have a better life?
Yes, certainly. The things that I mentioned before, having a healthy diet. So not only did I mention about including a fruit or walnuts and almonds in your diet and avoiding of junk food, I would like to make a special mention that inclusion of 1 bowlful of salad or 1 glassful of mutton milk actually before having or starting your meal fills the stomach. So as we tend to consume less carbohydrates, that is less roti and rice, thus we are able to maintain our weight in a better way. Also, having a fruit not immediately after the major meal, but that is lunch or dinner, but about 2 to 3 hours after the meal also gives a good control of the sugars not shooting up and having a better meal. So that is healthy diet. Also, the timings of the diet should be maintained. Women tend to delay their meals for responsibilities or any reasons. So that should not be the case. Meal should be a priority and it should be taken at the proper time. It should not be delayed. The third thing about meals is that they tend to take the responsibility of the leftovers in the house. So that should not be your responsibility. There are many responsibilities that you have. Leftover is not one of them. So you need not finish whatever is left over in the fridge. Regular exercise, as was mentioned by all of us, about 30 minutes per day, and at least 5 days per week should be your aim. Also, breathing exercises only does not help in anything. Breathing exercises should be in addition to other exercises, so that may help in addition to yoga or in addition to aerobic exercises or swimming or running or jogging. So that is how it should be. The third thing is yearly investigations. So I always ask my patients to time it at their birthdays or anniversaries so that they don't tend to forget. One should always undergo a screening, blood investigations and certain investigations once a year. So they include ECG, the cholesterol levels, that is lipid profile, and blood sugar levels, as I mentioned earlier. Also, hemogram, thyroid levels, and other kidney and liver levels, and urine test should be done. Time management should be a priority in a woman's life, so that she sleeps for 7 to 8 hours per day. There should be always something which is called as me time. So it can be as low as 5 minutes per day, solving a crossword for yourself, or doing a sudoku, reading a chapter from the disease. This reduces the frustration, enables us to fulfill responsibilities happily, and increases our efficiency and focus at whatever work we are at. Thus, we will get a better life.
All right. Well, thank you so much, Doctor. And clearly, lots of things for women to keep in mind as they approach menopause. But I think the main, point we want to make is that women need to prioritize their health. Thank you so much, doctors, for joining us on the program. And thank you for watching at home. Goodbye.